Hi, I am Dr. Mangesh Kamath. I am a senior consultant, medical oncologist, hemato-oncologist, and bone marrow transplant physician practicing at Helios Cancer and Hematology Clinics, Bangalore. Today we are going to discuss a topic. It is called chronic myeloid leukemia. Chronic myeloid leukemia is a type of leukemia, or what we otherwise call as blood cancer, which is very common in our country. Most commonly, leukemia occurs across all ages. Chronic myeloid leukemia most commonly occurs in adolescents, sometimes middle age, and also occurs in young kids as well. Now, chronic myeloid leukemia has a very interesting story. Many years ago, I would probably think before 2000s, chronic myeloid leukemia was considered to be a very difficult to treat blood cancer. It was as dreaded as many of the other aggressive blood cancers such as acute myeloid leukemia and acute lymphoblastic leukemia. Because there was no treatment which would help in giving durable benefit in chronic myeloid leukemia, cure could only be achieved by doing stem cell transplantation. And that would not be considered appropriate for most of the patients because chronic myeloid leukemia comes in three major phases. One is called as chronic phase, where the chronic myeloid leukemia, if treated, can be in the same phase for years together and nowadays for decades together. Second is called accelerated phase, in which chronic myeloid leukemia is a little aggressive but not entirely aggressive like a blood cancer. And blast phase or blast crisis, in which you will find that the chronic myeloid leukemia is equally behaving like acute myeloid leukemia. So, bone marrow transplant used to be done in the blast crisis and sometimes in the accelerated phase. So, it was very uncommon for patients to be controlled in chronic phase those days. I am talking about pre-2000s, where the chronic myeloid leukemia, when encountered in the chronic phase, would, despite treatment, progress to accelerated phase, then blast crisis, then either be treated like leukemia for some time or a bone marrow transplant. And if any of this was successful, patients could live for a longer time. But come 2000, there was a discovery of a magic bullet or a magic treatment, what is called as imatinib, which totally changed the life story of chronic myeloid leukemia. Imatinib and now second generation, third generation tablets such as nilotinib, dasatinib and many of these molecules, what they do is they basically provide a break to the failed break of the normal production of the blood cells in our body. This break provided by these tablets have helped clinicians like me control many of the chronic myeloid leukemias in chronic phase for decades together. In fact, I currently treat a lot of patients with chronic myeloid leukemia in chronic phase who have been taking treatment for more than 7-8 years and they are still doing very well and leading normal lives. So chronic myeloid leukemia, my friends, is not something to be completely devastated about. It is definitely a cancer of the blood, but it is not as aggressive as the acute myeloid leukemia. Make sure once you are diagnosed with chronic myeloid leukemia, the complete baseline evaluation is done, and after the complete baseline evaluation is done, the best of the best treatment is started for you by the medical oncologist, and after that make sure to follow up as prescribed by the medical oncologist, and you can live for many years with the disease, almost akin to living with hypertension and diabetes. A word of caution: do not try alternate therapies in chronic myeloid leukemia because none of them have been proven to be of any benefit whatsoever. There is a question that many patients ask me: Doctor, I have got chronic myeloid leukemia at the age of 20 years old. Can I live a normal life? Can I have children? The answer to the first question is yes, you can have a normal life. In fact, as I mentioned before, patients can live for more than 10, and now it is known that there are patients with chronic myeloid leukemia living for more than 20 years. And the second is, yes, you can have children, and for which you will have to go through a program which will be designed by the medical oncologist so that chronic myeloid leukemia can be controlled while you are undergoing pregnancy if you're a lady, or you can bear children even if you are a male without having any defects in the child. So folks, I will just summarize chronic myeloid leukemia to be a chronic disease now, and it's not a very aggressive cancer today. However, it has to be treated early, treated rightly, and treated for a long period under the expert supervision of the medical oncologist so that chronic myeloid leukemia can be lived with rather than be devastated by. Thank you.